A healthy community is one where everybody's basic needs are met. They have employment, they've got housing, they have access to nutritious and healthy foods. That gives them the opportunity to live an active and healthy life.
This Parks Foundation grant challenge is going to get 200 Washoe County employees to try to hit as many parks and trails as a wellness initiative. And the healthier we can have our employees be and be more preventive rather than reactive, the better off it is for the taxpayers.
Growing up in a community predominantly African American and Latino, we never even knew what a flu shot was. So I think having a community that's healthy, that knows of something as minor as a flu shot that can have such a significant impact.
It's important and vital that we work with our nonprofits, with our health districts, with our hospitals, with our job creators, with everybody, because we all essentially know that what creates a healthy community is one where people feel their best.
There's such a strong linkage between income inequality and health disparities. And as you move up the income ladder, your health gets better, and vice versa. And we've seen those disparities on display. The kinds of problems that we're dealing with, health, social issues, are complex problems. They're dynamic. You can get to them by principles, but not rules.
I really believe that this is something that we need to take care of and address. What we're doing here today is a part of a greater service here to make sure that healthcare is accessible to all of our constituents and all of our citizens within Washoe County.
Today is our first Family Health Festival to provide assistance with access to health care and social services for people in our community.
Today is one of our biggest events of Bike Week. It's again the mayoral challenge, and it's just a great time for us all to get out here and do a leisurely ride together with the councilmen and commissioners.
Well, cycling is a great activity for our community. It promotes a clean environment, it promotes healthy living, healthy lifestyles.
Well, today we signed an agreement with the Reno Sparks Indian Colony that allows us to work together to be able to dispense medication if we have a public health emergency.
I'm trying to find common relationships, especially with healthcare, in times when we're facing terrorism and we're facing pandemic diseases, and that could basically affect even tribal members.
From our perspective at the food bank, our role in creating a healthy community is really about making sure that folks have the food they need, especially healthy food like fruits and vegetables and dairy products and things of that sort. Our relationship with the health district goes a long way back, maybe 20 or 25 years. Food is really the foundation of good public health.
To me, it's very important that we collaborate with the health district. Great example is when we go into these very low-income housing, the motels, what we call the weekly motels. And you'd be surprised the conditions that we find. We work collaboratively to ensure that the properties are well maintained and that they are habitable, especially for the children.
They told you that he was going to make buildings. So
that's what we're inspecting pursuant to.
I would say that the health district is ready and poised for the future of our community.